Hi, everyone, and thanks for joining us today. It's great to see so many of you here, and please do make yourself known on the live chat brought to you by the Data Literacy Project. My name is Kevin Hanegan, the Chief Learning Officer at Qlik, and I'm joined today by Alan Schwarz, a Pulitzer Prize former New York Times reporter and a member of the Data Literacy Project's advisory board. So over the last 2 months, Alan and I have been presenting the webinar, Know Your Data, where we've been unpacking the data graphs, charts, and terms that we've all seen related to coronavirus to help you figure out what it all means for you. And after each episode, many people wrote in to ask us questions or suggest new terms to cover. So we've decided to take the series live, and here we are today. We'll be taking questions as we go through, so please do chat with us throughout the session. We may not be able to answer all the questions live, but we'll be following up afterwards on LinkedIn. One of the top episodes from the Know Your Data series was something that wasn't even a phrase. It wasn't even a word, to be honest. It was just one letter. And that letter is the letter R. So with that, I'm going to hand it over to Alan to get us started with the letter R.
Thanks, Kevin. It seems like we can't look left or right today without seeing some sort of headline that mentions the letter R, and everyone wants to know about it. What is the coronavirus's R number? Coronavirus R, is this the crucial number? And R naught, the messy metric that may soon shape our lives. And I got to tell you, that's pretty much correct. Now, what is R? Okay, now technically it is R naught, but we're all friends now, so we can stay familiar. R stands for reproduction number. And it's actually quite simple. It's the average number of people who, when one person is infected with a virus, that person passes it on to. It's a very rough, but at least instructive estimate of how fast a disease might spread without any intervention. For some viruses, it's relatively low, like the flu, about 1.5. But for measles, it's like 15. Measles spreads like wildfire without vaccination. Now, COVID-19 has been estimated between about 2 and 4. But as I said, this number does not need to stay fixed, because the R number is if we don't do anything to stop the spread. And that's vital, because whatever a virus's inherent R might be, it can be decreased by all sorts of things. How quickly infected people isolate, take other precautions like wearing masks, vaccination, things like that. It's a pretty long list. But the key here is that R, almost literally, is the beginning of reopening, okay? Because the reason you keep hearing so much about R is this is if even the crucial number that countries and states will continue to monitor when they're thinking of loosening social and economic restrictions in various ways, and then assess how that reopening is going moving forward. But one thing I want to emphasize is that this show is not about health policy. It's not about politics. It's not about even where and when. We're just talking about what R is and how it will be considered as a mathematical concept as we move forward. So, Kevin, take it away.
Yep. Thanks, Alan. So let's take a look at a few examples of various R values and see the impact of spread on the disease over time. So remember, as Alan said, R is the multiple of new cases, the existing cases on average when they're infectious. So let's start with an R of 1. And this means when there's, say, 100 existing infected people, those 100 people will directly infect a total of 100 new people before they recover. Those 100 people will infect another 100. So over time, this means the disease stays stable. Current cases don't meaningfully go up or down other than when other interventions are applied, like Alan mentioned. So let's say when R is greater than 1, let's say at 2. With those same 100 starting cases, those 100 during their infectious period will spread the disease to a total of 200 new people. It multiplied. The cases continue to increase, and the disease is said to be spreading and spreading at a high rate. And right now, as Alan mentioned, without any interventions, the R value for COVID-19 is estimated to be between 2 and 4. That's at least 2 that you see on the screen, and could be as high as 4. Now, 2 and 4 are huge numbers, But remember, you can knock those R values down a lot with various interventions that would impede the transmission of the disease, like social distancing, wearing protective masks, isolating infected people. These can all help slow the transmission and reduce that R value. But still, even smaller numbers that feel close to 1, like let's say 1.5, won't do much to stop the spread. If you look at the blue line on the screen, we've gone from our starting 100 to about 800 people in just 5 cycles. And maybe that cycle is just 1 month. That's still really, really, really fast. Zooming in even to 1.1, we still see the disease expanding, and quickly, depending on the time period people are contagious. Now, look below that 1.0 line, look at the light blue line. Now, that's lower than 1, that's 0.08. When R is less than 1, say in this example, 0.8, this means that our existing 100 cases will spread the disease to only 80 new people in that time period. Then those 80 people will then only give it to 64, and so on. So the existing cases will keep declining because more people recover than new people get it. If we wait long enough, and there'll be so few cases, the disease eventually will effectively die out. And that's where the term herd immunity comes in. And we'll actually be covering that in a future episode.
Kevin, before we continue, I'm happy to say that lots of people are chiming in on our chat. Now, one thing I want to point out is almost everybody is saying, great job, love this. These are not questions, folks. As flattered as we may be, please make sure to ask some questions, okay? Here's one. Susie Jackson asks, when was the R number first used? Now, Kevin, I believe you've done some homework on this one, so why don't you take that one?
Yep, thanks, Alan, and good question, Susie. Being a live show, I wanted to come prepared, obviously. So interesting enough, the R number in the calculation was first used back in the 1920s by an American, but not an epidemiologist. He was a demographer, and he was actually looking at the reproduction rates of certain populations within various regions. In 1950, an epidemiologist decided that the formula, given a few minor tweaks, could be applied to reproduction rates of diseases. So it was actually first used in a disease perspective, covering the outbreak of malaria in 1950.
And one thing I want to point out, Susie, is that, people think that R is such a new thing. It was not only used scientifically, as we said, back in, 1920 in various ways, but we're using it every day today. All of us are. I mean, investments. If our investments grow at 10% a year, that's an R of 1.1. And I got to tell you, we're going to be pretty thrilled about that. It's not a lot higher than 1, but it will make our investments grow. Now, on the other side, okay, let's just say you have some uranium in your basement, and who among us doesn't, okay? If it decreases, if it decays at 10% a year, well, okay, that's an R of 0.9. We're below 1, but 10% a year ain't getting you to 0 very fast, and you are not going down into your basement for a while. Okay, let me look to see if we have any other questions. Kate Baldwin asks, is there a globally recognized methodology for the R number? I'll take that one real quick. Thankfully, the factors that go into R are pretty established. I mean, I'm sure that different people weight different variables, maybe in different ways. However, the concept is you hear about contact tracing, and we've done a show about that. Okay, there are different ways for the virus to spread. You can have one, for example, right where I was born, New Rochelle, New York. That was arguably the first hotspot in the United States because one infected person went to a religious gathering and infected 50 people. Now, does that mean that the R is 50? No. Okay. But let's just say, all across the county, all of a sudden you're getting 50s all over the place. So you have to look at the localized R's, you have to look at the wider R's, and there are lots of variables. But, thankfully, all the arguments going on today about coronavirus, thankfully, and I take great refuge in this, math is math. And so I think that there's a lot of good feeling about that. Let's see here. Okay. Now, all right. Now, listen, folks, stop complimenting us. Ask us questions. You can even criticize us and we'll respond. We're very modest here. So how's this? Let's go to a graph of the UK and let's see how the UK interpreted all of this and what their strategies were and how it worked out. In mid-February through mid-March, the estimate, and again, remember, it's an estimate. No matter what variables you have, nothing is truly known here. But the estimate was that R was about 4, which is unsustainable. And that's why you saw these huge, huge interventions. Okay, 12th of March, self-isolation. 16th of March, social distancing. Schools closed. Lockdown measures began. And then next thing you know, bam, the R is now is roughly 0.8, which is everything you want. If you decrease 20% every time period, and again, here we're saying, let's just even say it's a week, 20% per week is amazing. But the problem is this is not sustainable. Okay. There are going to be ways that society opens up. And the problem is that each one brings an inherent risk of increasing that R. Almost by definition, any sort of opening up, all things being equal, is going to have a huge effect. And here's an epidemiologist in Italy talking about opening schools, which of course is one of the main things everybody's worried about, whether it's in the fall or summer school. If you're so close to the threshold of 1, and 0.8 is, an addition of 0.3 can be devastating. And that's true. And that's why, well, I suppose different states in the United States are being careful in different ways. In Arizona and Florida recently reported that R is 1.1, 1.2. And of course, that's getting attention from various folks. I guess I'm proud to say, sitting here in New York, we have the lowest R of 0.77. Again, these are estimates, but nonetheless, we're number 1. And as you know, New York likes to think that way. So let's see. Let's see. I hope I don't butcher your name. Prudvi, you can go offline and tell me. When you talk about herd immunity, how are you considering the effect of region and death rates and mutation in virus over time? Does R handle all of these multidimensional variables? So Kevin, let's look at that. Herd immunity, which by the way, we're going to cover, but we want to do this real quick. Region, death rate, mutation.
Yes.
I will say before you even start, we ain't worrying about mutation yet. Okay. But region and death rate, you have any thoughts on that?
Absolutely, I do. And just before I answer that, is really good. I just saw a couple of questions under it where people joined late and they were asking what R is. And I see some comments. There is a statistical programming language actually that Qlik uses to do analysis called R. This is something very different. This is the reproduction rate of a disease moving forward. So for those of you that just joined us, I wanted to kind of baseline there. We're talking about R, the reproduction number. Now, going back to the question, absolutely. I mean, at an oversimplified perspective, the herd immunity is just calculated by determining what the goal R should be. And so many calculations use 1, where it's not growing, it's just stable or a little bit less than 1, and what the current R value is. So to your point, it's not factoring in anything like has the disease mutated. So we know the flu mutates every year, which is why we have to get different flu vaccines. Right now, we don't have a vaccine for COVID-19, and we're going under the assumption that it's not mutating. So the herd immunity calculation is just determining it, with the quote unquote susceptible population, how many of them need to become immune, whether it be through vaccine, treatment, or natural immunity or similar. So we're not factoring in the mutations around that. So the calculation itself to do that is pretty straightforward, but there are a lot of assumptions going into that, like what is the definition of a susceptible population? And if the disease mutates, the population, obviously, the susceptibleness changes because people that have had it and recovered might not be immune at that point.
All right, I want to preemptively enter our lightning round here because we've got some short and sweet questions. Thank you, folks. Ram Krishna says, why do we need an R of less than 1? Again, because R is an exponent, and an exponent greater than 1, like 1.1, means you're increasing at a rate of 10% over some sort of time period. Okay, so you're going to go higher. If it were 0.9, like in our uranium example, you are decreasing 10% each time period. And so depending on what that percentage is, you're going to go up or down. Let's see here. Are you guys helping scientists crunch the numbers to help find a solution? Sadly, I have received no phone calls in this endeavor, although I've thought about becoming a contact tracer for the state of New York, and I might actually do that. Anita Stupka asks, could you present us R for Europe using Qlik? Now, Kevin, you are the chief learning officer of Qlik. Can Qlik software be used to do this?
Absolutely. I mean, from a visualization perspective, it's an exponential curve, or it's a curve, right, over time. So we can absolutely load the data in. And there are a couple sources globally that are calculating these for the inherent R value of the disease, as well as for regional locations as well.
Now here's Jason Baskaran. What is the best route? UK style lockdown, presumably USA as well, or Swedish style, let's just keep our distance? And I think it's interesting, Jason, that you bring that up, because you got it right. Sweden was originally reported as saying, let's just let people run rampant, get herd immunity, and everyone will be fine. And that is actually not what they did. What they did is they said, we're going to let our citizens behave responsibly and basically see what happens and not lock down proactively. Because if your hospital system, and again, we are not judging these different strategies, but they are out there. A lot of this has to do with hospital capacity. And if you're running out of hospital capacity and people are dying on gurneys, as we saw in some countries, you theoretically don't have a choice but to implement different strategies. However, if your hospitals can handle the sick, you do have the option of saying, look, people should just behave responsibly as if it were any other disease, and we're going to see what happens. Now, Sweden has seen a higher rate than they almost certainly would have otherwise, but they also haven't overloaded their hospital systems, and that clearly was a choice that they made. Let's see here. Well, one thing I want to point out, by the way, folks, is that this R concept has entered sort of the zeitgeist in such a way that even world leaders are starting to become conversant in it. Here's the German Chancellor, Angela Merkel, saying, if we get to the point where everybody infects 1.1 people, and this speaks to what we were just talking about, then by October, we will reach the capacity of our healthcare system. So that's where you see how small the margin of error is. So, the hospital capacity has been at the heart of so much, of so many of these decisions. So let me get to another one. Kevin, here's one. How long does it take to figure out what R is? We talked about different variables. Can you figure out an R daily the way that you have testing?
I mean, if you have all the variables, right, to figure out the current time and place value of an R for like today within a specific region, if you have all the testing data back coming about who is quote unquote infected, and you know how to calculate the susceptible population for that region, you absolutely can. But usually they're not calculating on a daily basis. They're looking at trends, maybe on a weekly trend. Now, one other highlight is there is the R0, R0, which is the inherent reproductive rate of the disease. That is something that is used as, without any interventions, as you mentioned, this is how the disease spreads. that takes years of data analysis and looking backwards at the disease, which is, again, why you see a lot of ranges with some of the more current diseases like SARS and COVID, as you mentioned, 2 and 4. Those seem like small numbers. That's the range is double, right, between 2 and 4. So that does take a lot of time and analysis. But for a specific region in a point in time, as long as they have inputs from the testing and the susceptible population, absolutely.
Okay, and I'm going to end up on one, believe it or not, that we're not going to answer. How should policymakers use R? This is Luen T. How should policymakers use R to inform decision making? And I guess I'll just take a whack at that one. Look, again, we are not saying what is and is not appropriate. Okay, should. I'm very good at not answering questions that have should. But we are seeing a variation. We are seeing, for example, in the United States, different states interpret or look at data in different ways. New York has been very strict, where I am. Very strict about following data, setting data goals in order to decide when it hopefully is time to reopen in various stages. Other states have taken different approaches. Many of them are now seeing upticks. How they handle that, again, is a matter of state business. Now, here is somebody with the fascinating name LinkedIn user. I love that. Very clever. Why does the WHO not initiate injecting antibodies to the healthy individuals so they would have resistance before infection is even possible? Is that possible? Kevin, you take that one.
Yeah, well, again, we're not here to give medical advice, but I think one of the things that I've seen on the news specific to this is there has to be a lot of testing done to make sure the antibodies going into other people is safe, effective, I guess safe first, obviously, then effective. And that takes time. So I think it is something that a lot of regions, a lot of drug manufacturers are looking into, but it's not something that we want to run into too quickly because there are risks with that.
Yeah, I mean, I do think that, I wasn't around in 1945 for the famous picture, but I do think that when there is a vaccine, you're going to see like a party in Times Square. Remember that guy who grabs the nurse and gives her a huge dip? I feel like our version of that is coming. So, folks, I think that what we're going to do now is we're going to wrap up real quick, okay? Because we are going to be doing this again, I'm happy to say. Kevin, a few people have written in saying, hey, I joined a little late. Can you do a quick recap? And so why don't you take that?
Absolutely. So let's look at 3 high-level things, we covered today. R stands for the reproduction number, and it's the number of new cases for a disease that an existing case generates on average while people are infectious. The R value itself is not fixed. It fluctuates over time as various interventions or sometimes lack of interventions are implemented. Perfect example was Alan showing the graph from BBC about the R value changing based off certain interventions being applied there. And it is a critical number that countries and states are looking at when they're thinking of social and economic or loosening those restrictions, the social and economic restrictions in various ways. And Alan gave a couple examples of how the governor of New York and the chancellor of Germany were quoting R values in their strategy for reopening.
Yeah, one thing Andrew Cuomo, the governor here of New York, says that if an R gets as high as 1.1, alarm bells are going to go off, his exact words. So folks, like I said, actually it's almost like this, it's like Sesame Street. This episode was brought to you by the letter R, and it's been a lot of fun. And we're going to do this again, as I said. Kevin, we're going to be back July 14th. Okay, our next one is July 14th. It's a Tuesday at 11 a.m. Eastern Time. Again, July 14th at 11 a.m. Eastern Time. So remember, we devoted this episode to the letter R because a viewer wrote in asking for it. So if you want us to cover something you've seen in the media or online or something that we flicked at today you want to learn more about, please comment at all of our handles here in various formats. please do include the hashtag BeDataBrilliant in your social post. We'll get it faster. We will consider it faster. Or email us. Even if you have any questions right now about the letter R, feel free to email us at hello@thedataliteracyproject.org. So for Kevin Hanegan, I'm Alan Schwarz. Please stay safe, and we'll see you again on July 14th.